Gift of Life Donor Program is the federally designated organ procurement organization for the eastern half of Pennsylvania, southern New Jersey, and Delaware. More than 36,000 people have received organ transplants in our region since our beginnings, and over 500,000 people have received tissue transplants. This would only be possible because of the gifts of families and individuals who wanted to change other people's lives. We lead the world in organ donation and transplantation.
We have a state-of-the-art, world-class facility in which to attract wonderful staff and to really have an efficient way to handle the donation and transplantation system. That involves the phone call, the call center, the operating room suites, where we can perform both the organ and the tissue recoveries. I've been with Gift of Life now for 21 years, and when I came I was one of 15 transplant coordinators, and so now we have over 200 employees who are dedicated to advancing donation and transplantation.
In the beginning, one might get a call from a doctor at another hospital. One would quickly get a team organized and go to that hospital and wait around and talk to the family and do the other things that are now done very efficiently by Gift of Life.
It was very rare. Most people didn't understand it. But you had some wonderful people who were really very generous about it and understood brain death, and they wanted something good to come out of the potential donor. And that was the beginning of it all.
In 1994, Pennsylvania Act 102 was passed. It's one of the most comprehensive organ donation laws ever passed in the United States. What it did was set up routine referral of every single person who dies in a hospital, so those people could be determined if they were potential organ donors. It increased organ donation in the first 4 years over 43%. It also set up a driver's license registry so that people could place organ donor on their driver's license. Now all 50 states have a driver's license registry, and about 110 million people have it on their driver's license.
The Gift of Life Institute is an international training center for donation and transplantation professionals, and with a mission of providing innovative training and consulting services to donation professionals worldwide. We've worked with all 57 OPOs in the United States. In addition, we've worked with leaders from approximately 53 countries around the world. Gift of Life Institute is home to a unique research study, the National Transplantation Pregnancy Registry, also known as the NTPR. Since 1991, the NTPR has been studying all aspects of pregnancies in solid organ transplant recipients and those fathered by solid organ transplant recipients.
We are participating in a lot of different research efforts right now in a project with the NIH, the Genomic Tissue Expression Project, where we're creating a biobank of tissue available for researchers.
We have really been able to complete the circle of care and the circle of life by providing the family house service.
Everybody just takes you in like they've known you forever. Everybody has a different story with the same problems that want the same result.
Every night at 6 o'clock, one of the coolest things happens at the family house. People from the community come in and cook dinner.
My son Brian was killed in November of 2012. He donated his organs and saved 5 lives. So we thought it was important to come down here to let the kids see we've lived the bad side of it, to let the kids see how important it is to give back.
If we can keep the family unit intact, we believe, and it's shown, that we have all a better chance of keeping the patient healthy and moving forward in their transplant journey.
Just to have that peace of mind and know that we had a safe, reasonable, clean food if we needed it or wanted it available was just a huge, just something you don't need to worry about. And for that, we're very grateful.
Everyone here, there's no one that hasn't just given me their heart and it's just wonderful.
The key to our success involves making sure that we have a team of people working together. And when I'm talking about that team, it's not just the organ procurement organization Gift of Life team, but it's the acute care hospital team, the nurses and the physicians who are taking care of these patients during their end of life, and our transplant centers. We know if we can do it together, we're going to get the best outcome.
What I'm most proud of is the fact that we continually improve the number of people who benefit from organ donations. It's important that we focus on the waiting list and those people that we serve. And only through public awareness and public trust can we continually improve the number of organs available for transplantation. So we have to find innovative ways to make sure that the public says yes to organ donation every single day.